Well, childhood obesity, it is not going away. And so joining us now is Dr. James Hawks from Portneuf Medical Center to discuss why it's so important to get kids moving. Thank you so much for coming in today, Dr. Hawks.
Yes.
Childhood obesity, we keep hearing about what a huge growing problem this is. Is that something that we're seeing here in our area, is increasing obesity levels in children?
Yes, it is. In the United States now, between 20 and 30% of all adults are obese. Mm-hmm. And there's different tiers of obesity. Being overweight is not the same as being obese. Mm-hmm. But I'm an internal medicine doctor, and so I usually see adults with complications of obesity. Mm-hmm. And obesity really affects almost every organ in our body. It can affect our endocrine system, prediabetes and diabetes, high cholesterol levels, high blood pressure, early heart disease, early risk for strokes, arthritis. It really just affects every organ. And what I usually tell the adult patients is that the best way to lose weight is to decrease caloric intake and increase their activity. Mm-hmm. And all of these habits start as a child.
At a young age. So what can we as parents do to help? I mean, it's one thing to say, hey, tomorrow I'm going to go run a marathon, but you can't do that if you have not run a marathon ever. How do we get that? How do we install that good, healthy living and that exercise living with our kids?
Well, I think the first thing is to have those good habits ourselves. Mm-hmm. And then in our house to have healthy eating habits, an active lifestyle, to find some activity that the family likes to do together so that the children will grow up thinking that being active is fun. Mm-hmm. And it's funner maybe to go ride my bike than to watch TV or play a game on, and to also find foods that are, nutritious for us and for the children. Mm-hmm. And
with kids, that can be kind of hard, I'll put broccoli in front of them and they're like, I'm not gonna eat this. Like, how can we get kids to eat healthfully when they don't want to put it in their mouth sometimes?
Yeah, and that's hard. And there's a lot of good healthy foods. Mm-hmm. And so if they don't like broccoli, maybe they would like something else, like a piece of an apple or an orange or nuts or something different. And if they don't like, a certain healthy food, if they don't like to eat meats or milks or, foods like that, then finding something that they do like, which is healthy.
Okay.
So choices are good?
Yes.
Yes. Very good.
Give choices.
Dr. James Hawks, thank you so much for joining us today.
All right. Thank you.